I'm sure some of you are not aware that most of the drugs you take during pregnancy can affect the development of the child in your womb. Oya, come closer. Let me educate you. There's a term known as teratogenicity. This is the ability of a substance, which could be a drug or a chemical, to cause developmental abnormalities on a fetus, which is a baby in the uterus. Some of the drugs that have teratogenic effects can cause birth defects like cleft lip or palate, limb deformities such as pocomilia, heart defects, brain abnormalities, neural tube defects like the spinal bifida, and absent body parts. It can also lead to miscarriages, growth restriction, or functional impairment of the baby's body organs. It's also important to note that this risk is highest in the first trimester of pregnancy, which is the first 3 months of pregnancy, because this is the period when the baby's organs are developing. Some common drugs that have teratogenic effects include some antibiotics like flagyl, chloramphenicol, tetracycline, gentamicin, and streptomycin. Some hypertensive drugs too have teratogenic effects. These drugs include lisinopril and captopril, and also other drugs that belong to the ACE inhibitors group. We also have drugs like warfarin and thalidomide, which have serious teratogenic effects. We also have isotretinoin, which is a drug commonly used to treat acne. Some drugs too, like aspirin, diclofenac, and ibuprofen, can have teratogenic effects when taken in high doses. In order to avoid these effects, it's important that you avoid self-medication and you stop taking over-the-counter medications once you're pregnant or you intend to get pregnant. Only take medications that are prescribed by your doctor or your midwife, because most times healthcare providers have alternative to these drugs. Always take your routine drugs, especially the folic acid, as it prevents neural tube defects and some of other deformities. I'm sure you've learned one or two from today's video, so kindly like, comment, and give me a follow. See you next time. Bye.